We can go ahead and start. All right, recording has started. I am now letting everyone in. And just before we start, Adrian, you're doing minutes. Ishmael, you're doing mute, unmute. Am I correct?
That's correct. Yep.
Okay.
And Ishmael, are you leaving at 4?
I mean, I can continue for this meeting for the duration. It should be okay for today.
Oh, okay, cool. Because if not, I can take over after you.
Not a problem.
All right, I am admitting everyone. Okay, good afternoon, everybody. I'm Dominic Zerlo, and I'm with the New Mexico Department of Health Medical Cannabis and Psilocybin programs. And we are going ahead with our next meeting for Propagation with Chris Peskuski as the chair. And so Chris, and just as a reminder for everybody, this meeting is being recorded. So we do ask that people watch their language. And part of the reason why we do not have the cameras on for most people and just for the chair and some of the DOH staff is just so that we can make sure that there is enough bandwidth for everybody to stay in the meeting as much as possible. What we've just discovered, because of the popularity of these meetings, if we allow cameras for everybody, we sometimes have people dropping in and out on a more frequent basis than sometimes happens otherwise. And then the other reason is just to make sure that there is nothing in the background that is inappropriate for when we post these meetings. We do post them on the program and the advisory board's website. And so if you've missed some of the previous meetings, you are welcome to go on back and view the recordings. So, and with that in mind, I will turn it on over to Chris. So Chris, back to you.
Thank you, Dominic, for, as always, for everything you do for the program. And thank you to everyone who has come to this meeting. I see a lot of names that have been here quite a few times, and like this time, and we'll have a moment for introductions coming up soon, but I always like to start my meetings off with just 30 seconds of silence to kind of try to cultivate a small container of peace in a world full of chaos, and just bring ourselves to center and remind ourselves why we're here. So just 30 seconds, please. All right, thank you all. And we're going to go ahead and open it up for people to introduce themselves. Please let me know who you are. Are you from New Mexico? And if you have any affiliations, remember, if you want to have a say in the voting during our meeting at all, you need to introduce yourself and be from New Mexico. So please start raising your hands and introducing yourselves.
Okay. Esteban, I've enabled your microphone. Please, when you're ready.
Good afternoon, everyone. This is Esteban Hernandez, owner of New Mexico Fungi and president of the New Mexico Mycology Guild.
Thank you very much for that, Esteban. Next, we have Denali. Denali, I've enabled your microphone. Please, when ready.
Hi, Chair. Hi, members of the department. My name is Denali Wilson. I am the Director of Strategic Support for the Healing Advocacy Fund, which is a nonprofit that supports state-regulated access programs. I am based normally in Las Cruces, but have been living the last month in Santa Fe for the legislative session, which ends in less than 24 hours, and I am very excited for that.
Thank you very much for that. Next, we have Ash Shelton. Ash, I have enabled your microphone, please, when ready.
Hello, I'm Ash Shelton. I'm born and raised in New Mexico, currently manager of Four Corners Fungi, and I'm also on the board of the Medical Mycology Board.
Thank you very much for that. Next we have Coley. Did I pronounce that correctly? Please let me know. I have enabled your microphone.
Oh, sorry about that. It's Chaylee, and
Chaylee,
hi,
thank you.
it's nice to be here. I am the founder and director of Entheogen Institute. I do not live in New Mexico. I'm just very excited for what's going on here and want to witness. Thank you.
Thank you very much, Chaylee. Appreciate that. And for the correction there, I'll keep that
It's a hard
next
one.
next we have John. I have enabled your microphone. Please go ahead.
Hi, I'm Jonathan Eastlick. I've lived here in New Mexico for the last 18 years, currently here in Albuquerque, and I'm a home mycologist. I've done some work with New Mexico. And I'm just here to help any way I can.
Fantastic. Sorry, you might have cut out a little bit there. I don't know if anyone else caught that. It's no matter. We have next on the list, we have John S. John, I have enabled your microphone. Please go ahead. Just a reminder, John, to unmute yourself, you have to click on the microphone icon on the top right of your screen. That way you can unmute yourself. And oh, I think I see it there.
Thanks, got it. My name is John Starr. Our organization is called Strong Medicine. We're based here in Albuquerque, in New Mexico, and we're just excited about the bill and want to participate any way we can.
Thank you very much for that. Next, we have James. James, I have enabled your microphone. Please, when ready.
Hey, James Blackford, New Mexico resident for about 20 years. Super excited about the program. Personally seen the benefits to psilocybin mushrooms. And yeah, just love the work everybody's doing and I definitely appreciate y'all.
Thank you very much for that. Next, we have Jim. Jim, when ready. Jim, just as a reminder, if you're having any difficulty there, just take a look at, if you unmute yourself, you have to, on the top right, there's a microphone icon. If you click that, that will unmute yourself. If you're still finding trouble, that's no matter. We can come back to you at a later point and we can try to get that introduction done. In the meantime, I shall continue onwards to Chris. Chris Guest, I have enabled your microphone. Please begin when ready.
Hello, I'm Chris Guest, New Mexico native and resident, owner of Four Corners Fungi, vice president of the New Mexico Mycology Guild, and associate professor at UNM.
Thank you very much for that, Chris. And next we have Lisa Ginsberg. I have enabled your microphone, Lisa. Please begin when ready.
Hello, everyone. My name is Lisa. I'm the founder of Changa Institute, and I am not a citizen of New Mexico.
Thank you very much for that. We're going to try and get back to Jim. Let me just take a look. I think he messaged in the chat, if I'm correct. Unmute is grayed out. Okay, let's take a look at what we can do there. What I will do is I'll disable and then re-enable. That might sometimes does the trick. So I have re-enabled your microphone. I don't know if you can see that. Does the unmute option show for you now? Okay, well, in that case, Jim, what I'd recommend is if you drop off the call and then join back in. Often it's the case that sometimes there might be an occasional little issue here and there, but sometimes it's a simple case of just jumping off the call and then jumping back on, and we can try and get that matter resolved. All right. Okay, without further ado, back to you, Chris.
Excellent. Thank you all for joining and introducing yourselves. I encourage all of you to be active participants in this process. I definitely want to make this, a communal process. So please be your most courageous selves and find your voices if you have something to say when we're going through this agenda, or through this process rather. So Dominic's posted the agenda up. This is a piece of, this is just a piece of paper. So I'm always flexible on this stuff. If we need to go down a rabbit hole or something, we will. I might change the order up a little bit since we have some people here early that may get pulled into stuff with the legislative session. I move item E up to the front of the list. But yeah, this is what we're going to talk about today. And now can we pull up the outline, Dominic?
Switching over now.
And can I call on, like I said, first thing we're probably going to do is go back over some sunset clause alternatives, since we had to remove our sunset clause last week. I wanted to invite Denali Wilson up to speak about some alternatives. If you're ready, Denali.
And just before you talk, Denali, I just want to make sure, can people see the document?
We can. Well, I can on my end. Don't know if about
A
anyone
few
else.
others. I'm seeing some other thumbs up. Okay, perfect. Thank you. Thank you, everybody.
Fantastic. And just before we begin, I believe our guest has returned to the chat. Just want to quickly find them. I'm sure I just admitted them. Okay, so Jim, let's see if we can. I seem to have lost them. I don't know where they're gone. Okay, no worries. All good.
When he comes back, if he, we'll just give him another opportunity when he gets back in here, if we can.
Absolutely.
Excellent.
No, I think
yes.
it was Jim Dodson, correct?
That is correct.
Okay, I see him.
Oh, yes, I see. Oh, there he is. Yeah. Okay. So your microphone has been enabled, Jim. Do give it a go if we can. Still grayed out. That may be an issue on potentially your end. Go for it. Go ahead, Dominic.
Yeah, so Jim, if it's grayed out, that means there is not a microphone connected. So for whatever reason on your system, a microphone is not showing. I will tell you, I experienced that earlier myself with a headset. So sometimes for whatever reason, they may not connect to your system. But if you want to try troubleshooting it there on your end a little bit, we will give you another opportunity down the road if you would like.
All right. Thank you, Jim. Sorry. Thank you for your patience. Denali, are you ready to come on?
Hi.
Board? Right.
Yeah, hi. Thank you, Chair. I want to mention too, Josh Capel, who's policy counsel for the Healing Advocacy Fund, is also on the call. And him and I had a discussion, and he may be able to add to this conversation. I'll start by reintroducing myself. My name is Denali. I maybe didn't mention in my intro, but I am a lawyer and a policy advocate, and sometimes wear that hat, and wanted to wear that in service of this conversation around residency and the sunset clause that was proposed. I also want to apologize for not being able to contribute to the conversation earlier. I know that there were previous conversations about it and we're reviving it, so sorry to have been late to contribute, but I'm grateful for the opportunity now. Dominic, is anyone from the legal department on this call by chance?
No, Denali, they are not at this time, but I can relay information to them, and they've also provided me with some additional information in preparation.
Okay, great. And I mean, we really do want to be a resource, not just to the subcommittee, the advisory board, but to the department in tackling some of these emerging legal issues. So certainly if there's an opportunity to have an individual conversation with the legal department, we'd love that in any way. So I wanted to start out by saying and maybe this has been a part of the conversation previously, but from my perspective, I think there is a sense in this community that we want to be as protective as is legally possible. And that comes both from a pride that we have as a state in protecting those business interests. And also, I think on the heels of what has been a turbulent cannabis recreational rollout, especially as it comes to outside business interests. I think those are big factors at play in the conversation here. And the residency requirement really centers around what is the Dormant Commerce Clause. So just to explain for people, the federal government has exclusive authority to regulate interstate commerce. And so what the Dormant Commerce Clause says is that states can't, right? States can't regulate interstate commerce because that's the exclusive authority of the federal government. But the thing that I think is really important for this conversation, and what I'd love to have a deeper conversation with the legal department at DOH, if possible, is that there's a circuit split on this issue as it pertains to residency and state plant medicine programs. And so while we have two circuits, the first and the second, that have shot down residency in cannabis programs, the Ninth Circuit, which is also the most recent case, has said, and I think this is kind of intuitive as we're talking about federal authority, that the Dormant Commerce Clause analysis really doesn't make sense because the interstate commerce that we're talking about is federally illegal. So the analysis of federal authority really doesn't hold weight. And that is the Ninth Circuit, which I'll mention too, New Mexico, when we're picking circuits, if we don't have one in the 10th where we are and there isn't a 10th Circuit case, we tend to follow the Ninth Circuit over the second and the first. And I think there would be an opportunity to do that here. And in general, just what a circuit split is when a legal question is unresolved, it's an opportunity to make a choice. And here, that choice, I believe, should be to protect growers as best that we can. I'll say two additional considerations for residency. One, that a residency requirement that's 2 years or less, and I think we're close to that window, it's just so unlikely that it would be challenged because the process of litigation is much slower than it is for a business to actually establish residency in a state. And so I think that as proposed, the sunset date for this residency was January 1, 2029, and with a program launch at the end of this year, that seems to be within that window. And the other consideration, cannabis is, for 1,000,001 reasons, just very different than psilocybin, but I want to highlight that my expectation is that this is not going to be as litigious of a group than cannabis, because there just honestly is not the kind of money to be made that fuels the kind of litigation around residency requirements. So those are those considerations. I think the other thing that the department could consider, if we don't want to permit a residency requirement, is a grower or is a cap for grower licenses, because if the department caps licenses, that then allows the department to create their own merit-based license system, and we could there very easily give preference to people with growing experience in New Mexico, or, for example, people who've paid taxes the previous year in New Mexico, and that, I think, provides the protective factors that folks are really looking for. and then just in general, right, the issue with residency and the legal issue is around not discriminating against out-of-state businesses with all of the nuance that I just provided. But there is nothing that prohibits the state from incentivizing New Mexico growers. So again, if we're not willing to move forward with a residency requirement, we should really be prioritizing any available incentive opportunities. I think, potentially partnership from the State Department of Agriculture or other state programs would be a really great way, right? The problem is discrimination against out-of-state business opportunities, but that doesn't apply to any kind of incentives that we could provide to New Mexico growers. And I think that's all, but I do want to ask if it's okay with you, Chair, to see if Josh Capel, who's on the call, has anything to add or amend from my summary.
Yes, please. Josh, do you have anything to add?
Hi all, and thank you very much. My name is Josh Kappa. I'm an attorney licensed in Colorado and a policy director at the Healing Advocacy Fund. And I think Denali, really summed it up quite nicely. I think the only thing I'd add is that there's a distinction legally between durational residency requirements versus current residency requirements, and requiring someone to be a resident of New Mexico for 2 years versus requiring someone to be a resident of New Mexico if they're holding the license. And there might be some way to play with current residency requirements versus durational to accomplish similar goals. Mm-hmm. And that is all I have. Thank you guys very much.
Thank you, Josh, for coming on and sharing with us. And thank you, Denali, for that update. Dominic, do you want to say anything on this? Do you have any thoughts so far?
Yeah, I mean, I can just say, and I appreciate the comments from Denali. I will say that our attorney for the department did actually expressly state that they did believe that the dormant commerce clause, the dormancy commerce clause, did apply in this, and that because even though there is a circuit split, if there was any legal action that did occur, that could actually stall and actually potentially stop the program from continuing forward as well. But we did experience that with regard to cannabis. And while I appreciate the thoughts, because we all want to think that everybody always has best of intentions. And I do believe that everybody that we have worked with so far at this time does have that. However, that doesn't mean that other individuals who do not necessarily have those best of intentions would not enter into the scene. And that could create and cause additional issues. But our attorney did say that they did believe that the Commerce Clause does apply, and that with that we would not be able to have that kind of a residency restriction on it. Now, as far as the incentives, I think that's a great idea. And we've actually talked about that before, including, I believe in one of these meetings it came up, might have been one of the other committees though, pardon me, because we've had so many, I can't remember exactly which one, but about incentivizing. And I think that that's a great idea. We just do not have the resources or funds through the department in order to be able to do that at this time. And so if there are other ideas on how to do that, that would be phenomenal. And I think that could actually be, that portion could actually be done either way, regardless of whether or not there is a residency clause or not.
All right, so you're saying that your legal team is adamantly opposed to the residential clause, even though New Mexico may follow, closer with the 10th Circuit ideation on this. and that DOH doesn't have the resources to set up a something that would help our growers.
An incentive program.
An incentive program. What would DOH need to set up an incentive program? I don't see that as being that taxing of a process. It would just be in addition to the permitting process to check that they've paid taxes the last couple of years, right?
Well, that wouldn't be an incentive program. An incentive program would be, for example, saying offering, unless I'm misunderstanding what Denali means by that, and I'd be happy to defer to her with regard to it, but it would be something like offering in-state organizations or companies, some sort of financial bonus or incentive in order to be able to start up, whether it be say, for example, a small grant, that sort of a thing, in order to be able to start. And we just do not have that. But if there's some other idea behind as far as for an incentive, we'd be very happy to hear it.
I think the idea was that we limit the number of permits and give we allow people that have paid taxes the last 2 years first dibs at those incentives, basically, or those permits.
So from a permit limitation, that actually we have lots of experience with having lawsuits with regard to limiting permits. So that really is not something that we're looking at this time, because that would create an issue. And while Denali is correct, if we were to do some sort of a situation like that, we could set up essentially like a request for proposal sort of situation and actually review, score the applications that come on in. However, that has its own issues and situations. And we did go through that for many years under cannabis, and it was problematic for everyone, including for the patients, because prices were, quite frankly, artificially driven higher due to that limitation. And there are a couple of people who have put things in the chat, and I just want to say that. The first one to Chris regarding the bill mandates that psilocybin be grown in the state. That is correct. It's not just even within the bill, but because psilocybin cannot cross state borders due to its Schedule 1 level, except for research purposes in very small situations or few situations, but otherwise they cannot legally cross state borders. So that is correct. And then as far as priority for licensing from Estevan, as far as incentives, first of all, there are no program fees. So there would not be a way to reduce program fees. If there were, that would indeed potentially be a way that we could do incentive. And as far as for prioritizing licensing, it really will be, again, if there's no limit with regard to licenses, then the licensing is simply going to be in order submitted, quite frankly. And similar to that, to Greg's question, is that the legislation does not currently allow us to actually charge fees. And part of that from the beginning was to keep this as affordable as possible.
Just to let you know, we have a hand up, Denali with their hand up. Please, Denali, go right ahead.
Hi, thank you. And Dominic, I really appreciate this conversation. I do continue to think it may be helpful if we could have an opportunity to talk with the legal team. I think, especially as you were responding to Chris's message about out of state, about the mushroom having to be grown in state, that's exactly the reason that the Ninth Circuit said, why are we talking about the Dormant Commerce Clause? Like, this is an interstate commerce, it can't cross lines. So that it's irrelevant. And I know that, right, there is a circuit split, so it makes sense for the legal team to be risk averse and doing what is taking the position that is perhaps the least likely to result in litigation. And there is a strong desire from community to to figure out if there is some protective way for us to move forward to protect New Mexico growers. I'm curious, so you mentioned, Dominic, that licensing would be like first come, first serve. Is there any flexibility or willingness to prioritize licenses for local residents? Like create that kind of priority system?
Well, Denali, once the rules are in place and the application process opens, it is open to all potential licensees. And so, because it's public at that time. And so once that becomes public, then any individuals or organizations can apply. Now, what I would say is individuals who are watching the process, who are paying attention during the rulemaking, would actually have, regardless, would have an advantage to it, because they would know pretty much exactly what was coming up and be able to have applications ready to be able to submit and be prepared, so that as soon as the applications open, they'd be able to apply. But we can't, there's not a way to delineate between in-state versus out-of-state, because we'd essentially have to review the applications to make that determination. And so it will be as they come in, we will be actually reviewing those applications as they come in to make that determination.
I think we have another guest with their hand up. Is it? I can't see his name.
John S.
John S.
Hi, can you hear me okay?
Yes, we can hear you, John.
Thank you to both of you. I had a question that's been in my mind for a minute. I heard, Dominic, you say no limitations on permits. And then I was just listening to the conversation about, if you're paying attention on these, you'll understand what's going on, and you may be the first ones to apply for these permits. Now, what I'm trying to understand is, for an example, like, so say, you go and you propose and you fill out all the paperwork at RLD, for example, a liquor license, right? And you meet all of the criteria, all of your boxes are checked, and you pay your fees, and your application is approved, you get a license. Do you see that as a parallel, or more so where there'll be a limitation, like, okay, in the first time we're going to give out 6 permits, or we're going to give out 12 permits? And that's because I heard the first come, first serve type thing. Is that the mentality? Or if you're there waiting in line and your ducks are in a row and your boxes are checked and you meet all the criteria, pay your fees, you'll be awarded a permit?
Right. So, John, that's a great analogy. And yes, essentially, that is what is happening. If there is an organization that meets all of the qualifications, they would then be issued a permit. Now, that will include, of course, having, not just a review of the application, but site visit, which happens in many other application processes as well. And so we'll be, as those applications come on in, those would get scheduled as quickly and as soon as possible. We'll include approximate timelines, as we do for other applications. We always put in approximate timelines within the application itself, so that people aren't just waiting to go, wait, I haven't heard anything, it's been 2 weeks. This way people have an idea of where they are in the process, and go through that. Does that help?
Thank you. Yeah, that's very helpful, because after watching the cannabis licenses come out initially, and being a witness to that, it was a big clarification or delineation I really thought was important to make about folks that are investing in creating situations to get ready for this application process, only to feel like all the boxes are checked yet not get a permit. So that's very helpful, and I appreciate it.
All right. So this is a conversation I feel like should continue, but maybe we need to get the legal team together with the Mycology Guild and some of our folks from Healing Advocacy Fund. Is there a willingness to, how can we make that happen, Dominic?
Well, as it's already been requested, and I've requested potential dates where they would be able to be available. Right now, the main reason why they're not able to is due to the legislative session. quite honestly. So hopefully I will hear back with some potential dates for that, and we can see about setting that up.
Okay. As far as our proposals to the advisory board, then should we put a placeholder in that? I feel like I kind of messed up this last meeting because we overwhelmingly approved the sunset clause in our propagation outline here. And then I allowed a vote to kind of revoke that, and it was barely passed. And I feel like that was a mistake, given that we kind of gave them that, entryway already to continue that conversation. And does that make sense, Dominic?
I would say that when it goes to the board, it can be that the committee, we explain it just as you did now, Chris, that, there was an initial vote and then there was a secondary vote, and leave it to the board at that point. But please remember, and this was for everybody on the call, is that when it comes down to it, these are our recommendations. And it's very important that the recommendations are there. However, the final versions of the rules may not necessarily have all of the recommendations in them. And some of them may be due to this type of legal issues, such as the attorneys saying, sorry, this is just not going to work. If we do this, there is too much risk, and that they consider too much risk from a legal standpoint. So it could be presented to the board with both options, and to move forward that way.
Okay, so I'm gonna continue pursuing the meeting with the legal team and the representatives from the Healing Advocacy Fund and the Mycology Guild. Esteban, how do you feel about all this right now?
Thank you, Chris. And first off, I'd just like to really thank Denali and Josh for coming in and sharing all this wonderful information with us today, and the department for being willing to continue this conversation. Really, the spirit of the sunset clause is truly to protect New Mexico residents, something I think we all ethically and morally stand behind. But as we all know, these things that are often ethically and morally correct are often not the easiest way to go about things. So I really appreciate the willingness to continue an open conversation. And I do want to let you all know that myself and the other members of the Mycology Guild are more than willing to participate in any other meetings, discussions, or provide any additional details we can to champion and support this. So thank you all very much.
Thank you, Esteban. And I think you hit on a really great point. And just to bring it is, we're trying to figure out what the best program is going to be for everyone involved. And I do think, Chris, there's a couple of comments in the chat just to sort of go on it is, that Chris has the comment about if we follow the same trend as Oregon, there's going to be a very small financial investment for out-of-state companies to start a business here. And that's another aspect of this. We are talking in many ways about what are the legal chances, the possibilities of things occurring, of suits being filed, that sort of thing. But the reality is we really have great communities here in New Mexico regarding this. And, I think in many ways that it's a point of trying to ensure that community support is there regardless of, who is allowed to get a permit, who is not allowed to get a permit. A lot of it comes down to, are we supporting our local communities? And that's actually part of why I had proposed with the idea of having a statement on the product information document regarding the number of years that a business has been established in New Mexico, so that people can support local businesses and really do so. And that way, that brings it to, look, we want to make sure that everybody knows what organizations and companies are local New Mexico businesses and which ones are not. And that way, that helps to support them without necessarily running afoul of the potential legal issues with circuit splits and everything else. I hope that helps to make sense, because we truly, really do want this to be a New Mexico focused, program.
No, thank you, Dominic. And I think that's a good segue into our next portion. So we'll continue to work the sunset clause through other avenues, and we'll be bringing it up again at the advisory board meeting on the 27th. But for now, I think we can table that conversation in committee and move on to our next section, where we're going to section 7, food preparation and product handling. So I can't see the document on my screen, so I'm in 2 different places. So there seems to be a little disconnect. Just
no, I'm about to put it into the chat also.
Okay, cool.
Pardon me, before we continue, just a quick one. I believe there was a hand up. It's gone down now, but whoever had their hand up, John S., please go ahead. Your microphone has been enabled.
Thank you. I appreciate it. I just was hoping for some sort of clarification. I did not participate in the meetings that began this conversation around the Sunset Clause and residency. Being involved in many New Mexico business over the years, are we talking about the duration of residency for, say, principals of a company individually that have resided in New Mexico for a long time? And as we know, many people start new companies all the time to start new endeavors. And so establishing the age of, for, say, a company, is that what we're talking about, or the, say, principals of a company and how long they've had residency in the state?
It actually was both, John.
Okay. Thank you.
That concludes all questions.
All right. I think we have another one in the chat, but this is going back to
I could read them out. Two
Yes,
questions. James Blackford, 2 questions. I don't see any particular criteria as to what would be approved as a grow site. For example, does it have to be a standalone building? Is a space in a home considered adequate for a grow space that would qualify for a permit, or would that be an automatic denial? It would be good to have what would be an acceptable site explained, so that we could so that there could be another check mark on that a grower could prepare for, as I do not see anything in the current doc that specifies that other than a secure location to store product. Sorry, that was meant. Sorry, that was the one question. The other one I answered as I was typing.
Go ahead,
Chris.
So I think it is kind of laid out where it talks about zoning requirements, but remember, these are initial recommendations. So your grow would have to meet light industrial zoning requirements, I believe is what we kind of put in there. But zoning requirements of the local government that you operate in. Did you have something else to add to that, Dominic?
You pretty much covered it, Chris. And so what that really means is in most places, for example, as long as the locality, the location allows for that within its zoning, and the different zoning requirements are different in different municipalities, counties, things like that. So as long as it is acceptable in those counties, then it could be done under those conditions. But again, it would still have to fit under, for example, in this next section, would still also have to fit under environmental health, food safety and handling, training certification. And so those sort of things is exactly a situation. So yes, as you say in the comment, yes, it would fall back to the locality with regard to that. And then just to answer Chris's, yes, that is actually a part of this current section that we're reviewing, that it would need to have that certification with regard to environmental health and food safety to be able to do it, but not necessarily a certified kitchen. You don't necessarily need a certified kitchen to fit in that food safety, but again, that is dependent upon the locality.
All right. Well, and food preparation, back to section 7. That segues perfectly. Does anybody have any comments on these basic rules for food preparation and product handling? Any adds or any thoughts here? Seems pretty standard to me.
There is a hand up from Lisa. Is that? Sorry, I'm also squinting a little to try to see all the small
Lisa.
items.
Let's go to
Lisa, your mic is enabled.
Thank you. So I have one comment. Speaking with growers in Oregon and Colorado, it became really clear that there is a need for anyway for current growers who already have functional mushroom production established to be able to integrate psilocybin production in their current infrastructure as well. Currently in Oregon and Colorado, that's not possible. A lot of these people have quite expensive facilities producing professional mushrooms for gourmet restaurants and Whole Foods and so on. And it makes sense for them. They already have established infrastructure. And I'm sure in New Mexico, you guys already have people who do professional mushroom growing, allowing them integrate that licensure in the infrastructure would be a huge benefit. Also, in addition to food processing, creating edible products like chocolates, gummies, and so on that would reduce costs significantly. The second comment would be considering enforcing a limit on number of licenses to produce mushrooms in big quantities to supply the United States. All you need is just one producer. Mushrooms grow really quick, require less maintenance compared to cannabis. So allowing more than 5 licenses to the state would lead towards businesses shutting down. So I would also encourage you guys to explore that as well. Thank you so much.
Thank you, Lisa. And just to note on that with regard to the integrating into current, there is nothing in our rules that are being proposed right now that would prohibit that. And exactly for the reasons that you mentioned. As far as limiting the licenses, again, if we do, that actually opens the program up to potential litigation. And that's actually a risk, which we have seen before through other programs and not just cannabis. So if everybody thinks it's all we're just comparing to cannabis, it's not. It's also happened in other areas. So what we do recommend and what we would be recommending with regard to from a licensing standpoint and for anybody who looks at getting into a new business, quite frankly, is to have your business plan well thought out and prepared. That's really the biggest difference that helps organizations to be successful in a new business. And that's going to be very important. We have seen that, of course, anytime there is a new field or a new business area open up where businesses will open and close. And we see it all the time, for example, in restaurants. It doesn't stop just because of a few licenses. And in fact, we end up hurting the field. And again, as I mentioned, we have a lot of experience in the past where limiting licenses for a medication such as what has happened with cannabis in multiple states actually has ended up hurting patients, especially due to cost issues and increased cost due to an artificial limit such as that. And then as far as just edibles, just so that everybody knows, all at this current time for these initial rules, we've actually stated many times that all of it will be homogenized and will need to be in either powder or capsule form. That we're not going down the road of edibles at this time, but that is on the table for the future. It's just that aspect and the additional issues that creates with regard to licensing from a food standpoint takes a lot longer to go into. And so to get the program started, we're starting with that process, and then we'll continue to look at the other food types or other edibles as the program matures.
So are we keeping this section in specifically for that reason, because we're looking forward to the program maturing?
No, it's still because it's an edible product. You still have to do from a food standpoint. So you still have to have those items. It's when you're manufacturing food, so baking, cooking, where it starts to become much more complex as far as creating rules.
Okay. I know we have another comment here. I would like to just put in a quick plug that you know, a lot of these conversations have been had in the past with regard to, you know, licenses and previous sections of this document that we're working on. So I want to try to bring us back in to focus on the topic areas that we're covering. And if you kind of missed the boat, so to speak, on some of those conversations. I want to make time for us to have them in the future, but we've already kind of decided those regs. So this might not be the best place, considering we've got a lot of work to do before the board meeting next week. So let's go to Liz, but try to keep that in mind that we're trying to cover some ground here today. Liz, did you have a question or a comment?
Go ahead.
Oh, Lisa, sorry.
Yes, one more comment that came to my mind in terms of packaging and labeling on how facilitators would package prepared food that clients can consume during the session. That's one of the biggest also questions that was on the table in Oregon in terms of some clients do lemon tacking tea when they consume psilocybin as a dry mushroom. With that, can clients bring their own food for the session? It's quite a lengthy experience, 6+ hours, can be in a healing center. And if so, if clients would bring their beverages, their water doesn't have to be packaged in commercial packaging, or they can bring prepared food. I think that needs to be also clarified and written down in the rules as well.
Thank you, Lisa. That's actually a part of the dosage and the administration portion, which is not a part of these rules, but that is actually something that has already been discussed as a topic that needs to be raised as far as food during that time period. So thank you very much for that.
Okay. So going back to section 7, are there any comments regarding this area of the outline?
And just since it's been a little bit, I'm going to put it in the chat again, just so that people can see it. And again, this is really about the that it has to, any conversion of the materials has to be subject to food safety oversight. So through whether it be environmental health, food safety divisions, depending upon the localities, and that there's not an exemption from standard food safety requirements.
And essentially for now, this just means basically taking the mushroom from the substrate block and grinding it up into a homogeneous product and then maybe capsuling it. Is that correct?
So, yeah, so it means things like equipment has to be cleaned, it has to be sanitary. You know, you can't go to the bathroom and then just start processing. You have to wash your hands in between, gloves, like, you know, all of those standard things that you think of from a safety standpoint when something is ingestible. Questions?
Your mic is muted, Chris.
Seeing no other comments or questions for section 7, I'm going to go ahead and ask for a consensus vote to approve that section and move on to section 8. So if you approve of section 7, please raise your hand.
At present, we have 6 hands up. 7.
Everybody go ahead and lower your hands, please. And is there anybody dissenting to that, to the approval of section 7? Seeing no dissent, I'll say that was approved by consensus or by vote rather. And we'll move on to section 8, talking about labeling, packaging, traceability. So section A says all packages need to be sealed and labeled. And we're going to go into the rabbit hole on labeling, I'm sure. So the next elements are the required label elements, and the label must be printed or affixed on the product package and must include all required information in a legible font, at least 8 points, be in English, though it may be provided in other languages, be obstructed and unobstructed and clearly visible, the producer's business name and permit number, the type of product, for example, homogenized fungi, the species name of the fungi, and I think I might want to add something right off the bat to that, Dominic, maybe the cultivar of the fungi as well.
So make that species and cultivar.
Yes.
Okay.
The net quantity of contents using the metric system of measurement, the potency of psilocybin analytes contained in the product expressed in milligrams and calculated using laboratory test results. Total potential psilocin report both OR1 TPP or TPE, total psilocybin equivalent, or total potential psilocin. Dosage and administration went with total potential psilocin overwhelmingly. That's what they did both in Colorado as well. I've heard a lot of feedback from both Colorado and Oregon that is causing a lot of confusion, so that may be a topic for discussion. A logo designed and provided by the department that notifies a reasonable person that the product contains psilocybin that is no smaller than a 1/2 inch by 1/2 inch. A unique identification number of the product lot and the state track and trace system number or identifier associated with the product, the expiration date, and are we missing something there?
And then it's the statements, which basically are the risk, benefits, drug interactions, and effects of psilocybin are not fully understood. Individual results may vary. Statement saying keep out of the reach of children, and the statement do not drive a motor vehicle or operate machinery while under the use of psilocybin. So basically your usual warning labels.
Should we add something on here that packaging cannot be targeted towards kids or something like they've done with tobacco and marijuana?
I don't think that's necessary at this time, and the main reason is because remember, this is going directly from the producers to the clinical settings or the therapeutic settings, and so it's not like cannabis, it is, or unlike cannabis, it's not something people will be able to buy in a dispensary and bring home. There'll be items that have to, that are coming through that, so similar to a doctor's office.
And remain locked up. Okay.
Yeah, exactly.
All right, so let's go ahead and talk about sections A and B. What are our thoughts?
And the only other aspect I'd like to say, Chris, before we get into it is, as people can notice in the chat, is it also has section C, which is a product information document, which has a lot more information. We're really trying to ensure that that it is one of those situations where you don't get a CVS receipt. To name a particular company, but that it's not suddenly you're getting a couple of capsules or a sachet with your dosage in it, and along with it you get a 3 miles worth of paper that is just labeling this. So it's really about trying to keep this smaller, so that on that portion, and then other information that an individual would want could be done on the product information document, which can be done electronic so that we're using less paper and killing fewer trees. And so that's part of the idea on it. And so just remember and keep that in mind, because we're not talking about large packages to begin with, regardless with regard to this. And I do see in the comments there, rewording a little bit from Greg. We can definitely look at that. And Esteban, when you're saying white label program, what do you mean regarding that? Oh, unique branding. Yeah, I think unique branding would be allowed. That's not a problem. It's not a situation of this needs to be black and white label. Is that what you're asking? Okay, thumbs up. Okay, thank you. Yeah.
So, and I think as far as Gregory's comment that the alkaloids we could probably put on the product information document. I would like to see the basic label elements be as bare minimal as possible. That way we don't overwhelm people with too much information and they don't read any of it. That would be my thought on that. If they want deeper dive into full test results, that could be attached to the product information document.
Right. I would agree. And that would be a part of the results of all laboratory tests. Oh, formatting got a little messed up there. And the results of all laboratory tests are actually on in C. And just to answer Lisa, that is a conversation that has occurred previously, and the program is not limiting particular cultivars or species.
All right. Should we? I guess I'll go ahead and read C as well and D, just so we can close this section out and then come back and look at it section by section. So product information document. A product information document must be available that lists the following information in English on a printed or electric document in 12-point font or larger. All of the requirements for the product label, a statement regarding the number of years the business has been established in New Mexico, and a statement declaring the state and country of residency, including the length of time of the primary investors, results of all laboratory tests conducted on the homogenized batch, data homogenization, the type and composition of the growth medium used, including type of grain, soil, compost, pesticides, and other inputs, date of manufacture or processing of the final product, list of all active and inactive ingredients in descending order of predominance by weight or volume. Why is this a bullet, Dominic? It should just be homogenized fruiting body of mushroom, right?
Right, but there could potentially be other ingredients that are in there, but it should not be more.
Okay. Growth medium used, list of potential major food allergens which might be contained in the product or in the growth medium, identity of the intended use and directions for use, and a description of how the product should be stored. The following statement: this product is not approved by the FDA to treat, cure, or prevent any disease. FDA has not evaluated this product for safety, effectiveness, and quality. There may be a long-term adverse health effects from consumption of psilocybin, including additional risk for women who may become pregnant or are breastfeeding. The New Mexico Poison and Drug Information Center phone number. Section D, traceability and tracking. Utilize online tracking system as required by the department. End-to-end batch tracking from cultivation through final product. Steps for grow, harvest, processing, testing, transport, sale. Records retained for a defined regulatory period of 5 years. Okay. So, please, what are your thoughts on Section 8 in its entirety?
And just in the chat, for those who aren't able to see it, I did put that Section D for the traceability as well. And James had a question about whether the DOH producers would create an example label. And yes, there would be a sample label. I don't see any other. Oh, and John had actually put, for example, as far as other items that might be in the medication would be the capsule, for example.
Very well. Thank you.
Again, John. Shouldn't be much.
All right.
And just to let everybody know, we've really tried on this. We've had some internal conversations as well. For example, some of the statements for the label, just due to a room issue and to create a smaller label, of moving some of those statements onto the product information document rather than leaving those on the label itself. The one that we have sort of been very clear that needs to stay on the label no matter what, and it's more from a safety warning standpoint is the keep out of reach of children. Leave that on the label regardless, but potentially move the others onto the product information document.
Any thoughts on the label? Denali?
Yeah, and sorry, maybe you can fill me in on previous conversations. I'm grateful to hear there's consideration of, you know, what the burden will be on folks who are preparing that, just with how long that is. I just, in general, a lot of these things are about informed consent, which really is the responsibility of the facilitator. And so I want to be sure, as much as we're wanting to provide consumer information on the product, really that responsibility should lie in the training and education and care protocol with the requirements that we adopt around informed consent.
I agree, but I think the facilitators also need to be aware of all this to provide or to educate and receive informed consent.
But and Chris, I just added
so
that.
can I just ask this,
Oh.
the medication, the document, that's separate from like what is going to be required on individual packaging? Am I understanding that right?
Yeah, that is correct, Denali. But
Okay.
what I've done, because you raise a good point, and we actually have mentioned to make sure that that's there, but we did not have that as a bullet point here in this outline, and so I just added in under the main part with the packaging, ensure the facilitator provides this information, and I was typing it as I started talking, for the label and the, what are we calling it again? I'm sorry, the product information document.
And they need to provide that to the client, correct?
Yes, right.
Is that clear in there, or
Sorry, I'll get it here in just a moment. I'm just
Okay.
having a typing issue. Okay, I'm putting it in the chat just so everyone can see it, for those who aren't seeing it on screen.
That was a good catch, Denali. Thank you.
Yes, thank you, Denali.
Other comments, concerns about this section? Okay, does this committee have a preference towards total potential psilocin, total psilocybin equivalent? Am I alone on this rock
So,
in space?
Chris,
Yes.
oh, go ahead. I defer to public comment on it first.
Go ahead, Greg.
Greg, your mic should be enabled.
He said everything without a mic. Sorry about that. I think, although it is not necessarily this committee's decision, I think the influence of our voice can be in conversation with the bigger picture. I don't think it's going to be difficult to include both psilocin equivalent and psilocybin equivalent. And I think that might be the best way to go. I have a good visual example of how that could look if I can put that in the chat. But I think, I think we just kind of table that for now.
Yeah, so having both scares me more than one or the other, because I feel like that increases the chance for confusion. But go ahead, Dominic.
Well, Greg actually said pretty much what I was going to say, because these are about formula, and we're actually already asking in the testing section for all of these tests to be done that actually make up both formulas, and it's just a formula. At this point in time, we could move forward with having both on there. We also do have the provision that the department can reduce things if they are found to not be necessary. So for example, some of the testing, and we could put that in as well on the label. Therefore, we don't have to go back through a rule hearing if something is deemed not necessary at that time. And then that could still leave the decision on whether TPP, the total potential psilocin, or total psilocybin equivalent, for the dosing and dosage committee to make that determination. Does that make sense?
So you're saying just leave both of them on there for now, and we can.
Because both of them are really just formulas based upon the test results, the potency test results. And so we could leave them both for now, and then based upon what the dosage committee comes up with, then we could actually, the department could say, whichever one does not make it for the dosage requirement, we could then remove at that time.
Okay. Should we change the document just to say the dosage in milligram per gram, or leave it open for both of them on there?
I would leave that open at this time.
Okay. Gregory, did you have another?
I just almost exactly what Dominic said with an asterisk, deferring this language so that the ruling body defines so whatever is defined by whatever is going to be the language. The thing that I think I saw Dell in here, and I don't know if Dan is here today or anybody else who's from testing in other states. Many states and many testing facilities post total alkaloids, and that does include, or total alkaloid content, and that does include the minors in the way that they calculate that up. But I would love somebody from that expertise to speak on that matter. I think if we keep it psilocybin and psilocin equivalency with the minors being measured separately, I just want to make sure we have sanity around that conversation, if that makes sense.
I think we're testing them individually, so based on what I see in this document, we would put the results of all laboratory tests on the back, and so we would have individual results for psilocin, psilocybin, and the 3 other alkaloids that we're testing for, all reported separately on that product information document. Does that answer your question, Greg? That's how I'm reading this.
We have another question there by James Blackford.
James, go ahead.
So we can put a pin in this. This is kind of like a side question, but it was briefly spoken upon as far as dosage, and it each patient, each facility may be different, but is there going to be like a standardized dosage? Because I know as far as the growers, when we are putting them in capsule form, measuring out the milligrams in each capsule, that'd be inventory we order and stuff like that to do that specifically. And then if the standard is a different dosage, is there anything around that to kind of let growers know, what to expect, that's my question. If that needs a pin in it, that's fine.
I think that's still to be determined through the dosage committee and the advisory board. So we're going to work on that. I don't know the answer to that, honestly, but that is something good to keep in mind, that, whatever dosages or dosing strategies we come up with, assuming we do, we need to relay that information to the lowest level. And it also brings up something else I've heard from lessons learned in Colorado, that, if we are going to sell this in one unit of measurement, dose it in another, and store it in another, that also creates a lot of confusion. So maybe some parallelism as far as how we are what unit we are working in throughout the entire process. And I'm not sure if this would be the best place to start that conversation, but like if we're gonna work in psilocin, then everything should be done in milligrams of psilocin, or or psilocybin. Go ahead, Greg.
We don't need to spend much time on this, but I think from a sales point, gram weight of biomass is how you're going to sell it, and the facilitator can decide how much of that biomass based on the information on the packaging they provide to their people. Like the dosage is, because this is being given to a person by a facilitator, but that is under the system, is being given, those decisions get made through their risk profile assessment. Does that make sense? I don't want to start selling it based on psilocin equivalency. I don't think that's a good idea.
Yeah, let's continue down the list of how it is that your name. Oh, I'm sorry. I'm gonna butcher your name. Is it Shelly?
I figured if you don't know how to say it, you're talking to me. It's Chaley. Looks like Coeli.
Chaley, yeah.
Yes. If I may just chime in here,
Wait, sorry, my phone. Psilocybin analytes a nice way, being that I'm licensed facilitator in Oregon and doing it now for a couple of years. There's very much consistency with dosing when you measure in the analyte. It's nice to have also the grams of weight, just so that new facilitators can wrap their brain around that, because a lot of people think in terms of grams. And it's lovely to have the analyte on there, but I wouldn't use that as your only measure, because it's such a small amount and there's no consistency with dosing in that realm. But it's useful information for people that want to. That's all I have to say. Thank you.
Thank you. Let's go to James.
So just to round off my point, and as the one prior had stated, it would be total weight, and the homogenized product in a powdered form, if it's essentially put in a capsule, those capsules are different sizes and the weight would be set in each one. So having kind of a standard is like a base unit, per 20 milligram capsules or whatever it would be good, because if a grower, produces this end product, capsulates everything, say at a 20 milligram weight, seals it in its final product, and then it's like, it's going by 0.25 milligram and stuff like that. And so I guess that was my point. To maybe have some kind of standard as far as like the base metric, as far as what that would look like.
Yeah, I understand what you're saying. I'm just not sure we can decide that. That seems like something more for the dosage committee, if they're gonna do, a standard dosage unit, and that would be with increases. I mean, my perspective on that is dosage is very individual, and we shouldn't be, kind of dictating what those dosages are on either side of the range. But I don't know. I'm only one part of this cog, so okay. Coming back to what we need on our label elements, do we need to make any changes to this as far as putting a unit that these need to be measured in? Or are we gonna sell it in grams, dose it in milligrams, and store it in kilograms. It sounds reasonable to me, but I guess that there has been issues. All right, let's see. What was that comment?
And just so James just commented milligram per capsule with total weight per package, and that actually does really fall under the net quantity of contents using the metric system. And so it is pretty consistent with regard to that, and then also have the potency. And so what I think James's concern is, and please correct me if I'm wrong, James, is that you don't want to necessarily see that one producer is, for example, doing in milligrams per gram while another is doing gram per gram type of a thing. And I think that that will very quickly actually even out regardless of what we do regulation wise on the label, and is really going to be based upon what the dosage committee recommends as far as for dosages and dosage ranges, if that makes sense.
Not seeing any more comments from James.
Okay.
All
and
right,
Greg
so
is commenting to motion to adopt the language.
all right, is everybody comfortable, or I think everybody seems comfortable adopting section 7 or section 8 rather in its entirety? See thumbs up from everybody. Are we good with this? Got 1, 2, 3,
4.
Right.
Okay.
Is anybody opposed to section 7 or section 8 as it is? Esteban, what's your question?
Thank you, Chris. This is just regarding the traceability section on section D.
Ah, yes.
Yeah, within that section there, utilizing online tracking system as required by the department. I'm sure that's something that's still up for discussion potentially. I would just hate to pigeonhole us into, a requirement that we all have to use one proprietary software and, it's $5,000 a year, whatever the fee may be for it. So I think that would just merit some more discussion perhaps.
Okay.
So,
and you guys ran into this with cannabis, didn't you, Dominic?
So here is the issue with regard to it is, as we move forward looking at systems, one of the requirements that we have always done from the medical side is that whatever tracking system is required, that the elements that are required by the department have to be offered free of charge to the end users. So in this case, the producers and the clinics, so that they wouldn't have it. Now the system that we use currently, for example, does also then have sort of a pro version that has additional bells and whistles that people can purchase, but that's not something that is required. But the actual tracking aspects of it, which include point of sale, by the way, they do have to offer that at a no charge to the dispensaries. And again, that was as it was operated under the department, when the department was operating those aspects of the cannabis program, and we would be doing a similar situation with regard to this. I hope that answers that, Esteban.
That's a good catch up, Esteban, and it sounds like he's satisfied with that.
Yeah, and just to give you an idea, so like some of the add-on programs, they do things where, for example, they'll then track other aspects. You can do other fancy things like doing emails out to your clients and your sales folks. But again, that's a very different system because you're looking at a dispensary model, not at a clinic therapy-based model, where things are going out specifically to those patients individually. And that is actually something that we would look at from a functionality standpoint, being able to message with patients. So similar to if you're at your doctor's office or hospital system, where you have that ability to, to reach out to them through their online portals, we would have something similar to that.
Excellent. Okay. So again, I'm gonna open it up to dissent for section 8, labeling, packaging, traceability, tracking. Any dissenting voices? Excellent. We'll call section 8 approved by consensus. Now that I've got my afternoon spam call in the middle of the meeting, we'll move on to section 9. Compliance. Compliance authority, the department, New Mexico Department.
Oh, that's a Department of Agriculture.
Agricultural, okay, agriculture for applicable permits, local building and health departments, inspectors for local permits, clear corrective action pathways prior to license suspension or revocation. I'm assuming that'll be handled through the Department of Health, right?
Yes, and some of those are fairly standard, and so with regard to it, and so just to give an idea, and please forgive me if I don't have the days correct, the number of days, I mean. So for example, essentially, if we were, for example, to go and do a site visit at a location and we were to find a cat was wandering around on the processing tables where products were being homogenized. The department would then issue a notice of contemplative action, is what they're called. And essentially what we would do is that particular permittee would then have so many days to be able to correct it and submit documentation showing that they have corrected that violation. And once they do, then things move forward. If, however, they say, you know, the permittee says, no, that's not something that actually happened. Your inspector, when they came in, was seeing cats when there were no cats, and they could actually appeal it. And so there would be an entire appeal process so that they could go through that and go through that sort of portion with that. And the reason for that is we need to make sure that that's very clear so that everybody involved sees all of those steps in it, and that they see what are the potential actions on it. And of course, the final portions of that would be if indeed, yes, there were cats in this particular situation, it was not cleared by the permittee, then the permittee could potentially have their permit suspended and or revoked at that point if they don't clear those kind of violations. And but it has to be a very clear process saying, you have this amount of time. So for example, 30 days to clear that issue, but within 10 days, they have to appeal it, say, no, the cat was never there. And then if they do that, then it is revisited. There also has to be the availability of there being a potential hearing. So for example, prior to the actual suspension or revocation of a license, they have the right to a hearing. And that is done with hearing officers that the department arranges for, and to make sure that that's very open and clear with everybody who is involved. And so that's just that process, if that makes sense. And hope I didn't confuse it with bringing in the cat. I actually say that because that was an actual situation that happened years ago in the cannabis world.
Yeah. Everybody loves cats anyway, so I think you caught their attention.
Everybody loves cats. I should have just put one up on the screen instead of the document.
James, let's hear your comment, please.
Sorry, I just meant to do a thumbs up that yes, everybody loves cats. I hit the wrong button.
And I like Gregory's comment. Shout out to the Schrodinger's box. Yeah, it's great. Any issues with compliance section? Okay, this seems pretty straightforward. Seeing no comments, concerns, questions, or recommendations, I'll go ahead and look for consensus again. Please give us a thumbs up if you approve for section 9. All right, I'll allow room for dissent. Anybody dissent of section 9? Okay, we'll call that adopted by consensus, and we'll move on to section 10. Future expansion and review framework designed to be scalable, periodic review for scientific developments, public health data, and operational performance. I think Dominic and I have had this conversation several times that this is a ongoing process. And we'll probably be working on this for years to come. Or we will be working on this for years to come. So, any comments, concerns with section 10? Anything else we should put in there?
Yeah. And Chris, we don't actually need to vote on that because that's really just saying this is what we need to ensure we continue doing moving forward.
Okay. Good to go.
But I do have one area that we realized just the other day is not actually in here. And I'd like to just actually ask the committee for a little bit of indulgence. And what it is transportation. And it's the transportation of the product from the producer to the therapist, facilitator, therapy center. And what we really are looking at with regard to that is really just saying that, look, it needs to be transported by, people who are doing so safely. And so making sure it's in a locked box, for example, that the person who is transporting it doesn't make a bunch of stops on the way. So for example, you don't want someone who's driving the medication from the producer to the clinic. You don't want them stopping off at 7-Eleven, for example, and suddenly their vehicle gets stolen because they left it unlocked, or that the box that it's locked up in inside is not secured to the vehicle, and so somebody just reaches in the open window and grabs it, and and so they end up losing the medication. And so if it is okay with everyone here, we'll actually develop that to add into the rules, just to ensure that transportation is done under safe and secure manner. Would that be acceptable?
Yeah, I have gotten some feedback from people in Colorado, and given that this is a rural state, there's been, I guess, concern that, some of the producers are having to drive really long distances to deliver their product. So one of the recommendations was that they were able to meet with other handlers, the facilitators at some determined place and do transfers. I don't know how the department feels about that. But it was something I had to take in consideration given, where we might be trying to get these products throughout the state. Is that Gregory with your hand up?
Yes, it is. I would just like to voice a preference or perspective of, in the heart of everything that we've kind of done in regulation mitigation, to, during this first phase, reduce the kind of chain, like, let's not include chain of custody or like transfer manifests and stuff like that, so that we can loosen like who can, and just like keep the recommendation as safe and secure as possible. And that would allow for pickup, that would allow for drop off and meeting and stuff like that. I don't know how detailed your structure will come out, but yeah, like I think leaving it in the spirit of what we've done so far for other regulations would be nice. As we ramp up, that way we don't need transportation companies.
Thank you, Greg. Regardless, I will tell you right now, because it's a Schedule 1, we would need that from a legal perspective to have a chain of custody, but we can easily write it so that it does have other individuals, whether it be contractors, facilitators, that sort of thing, who could either meet up or pick up themselves for that transport.
Awesome, thank you.
Is this going to be an extra required permit? Do we need to add that to any of our other sections?
I don't think it needs to be an extra permit, especially if it falls within either the current permit system that we're sort of doing, so a producer could do it, and we can ensure that we add that on in for that facilitator wellness center, whatever they end up being named when the committee meets on that. We can ensure that that same language is there so that those individuals could, and we can ensure there's language with regard to contractors, which would mean someone else. So, for example, if we were transporting it, and whether it be the facilitator and or the producer who hired a third party to do it, as long as they met with the regulatory requirements, so keeping it safe and secure, it would be acceptable. And that's actually where the chain of custody manifest form protects them.
Okay, Gregory?
Just like earmarking a much later conversation for the LEA interface around all that and how those protections and like how the legal part of that stuff stands to protect the transport entity, but not today.
Okay. Any other concerns around transportation? And so is this the language you're going to use, or are we just using this as the DOH is going to kind of create the language based on this little blurb here?
We'll create the language based on the blurb.
Okay.
Because remember, all of this is really the outline for the recommendation, but the specific language goes through our legal and all of that to make it look regulation standards.
Legally.
Yeah, regulatorily, I don't even know what word I could make up to make it sound right. But to do that, because there are certain ways things have to be written, language that's used in order to make sure that it's clear and that we don't run into issues. Because as we've sort of noted before, commas can make a big difference in how something reads.
Yeah. Let's look for consensus on transportation. All approved, please give me a thumbs up. All in favor. Two, 3, 4. Shift 4. I'll be 5. Anybody opposed? Okay, we'll go ahead and approve transportation. We already decided or talked about not needing to approve section 11. And that brings us to section 12. Are we going to go into these definitions here, Dominic, or what's your recommendation on that, how we handle this?
I would recommend we don't really need to go into the definitions, because again, this is something that with our legal team or our attorneys, they'll actually go through to make those decisions. We can provide them with this so that they ensure that the definitions do meet with what is needed. I would say we don't need to go through each of these. I know I've read through them and overall they seem very clear. And I'll put the definitions into the chat. Just realize that, again, our legal team may change some of the language a little bit or add in language where necessary and needed. But I don't know that we need to have a vote specifically on definitions.
Okay, if perhaps we should just go through them since we have the time and make sure that we're all in agreement with these. I don't think we ever talked about them. So facility means any building, space, or grounds licensed for cultivation, harvesting, drying, storage, preparation, psilocybin producing fungi or psilocybin products and subject to inspection and regulated by the department. If anybody's got any comments or questions, just raise your hand. Harvest means the act of removing psilocybin producing fungi from a production environment for drying, processing, or storage. Lot means an identified portion of a batch that is uniform and intended to meet specifications for identity, strength, purity, composition. I don't think we used lots anywhere before. Should we remove lot?
We actually are going to use lot to help differentiate. And I would just say it's because you do have that between a batch and a lot, but this actually does not have a definition of batch in it. I was actually just writing that in the chat to James. That is actually up earlier in the other section talking about that definition of a batch. So, and again, this is not a comprehensive list. This is just some ideas.
Okay. Specifications for identity, strength, purity, and composition, and that may be subject to testing, quarantine, or recall. Licensed premises means specific facility or facilities identified in a producer's license application and approved by the department, within which the producer is authorized to conduct regulated activities. I feel like that should be permitted premises since we're not using licenses, but I could be wrong.
Yeah. No, you're correct.
Okay. Producer means a person or entity licensed by the department to cultivate, harvest, dry, store, and prepare psilocybin producing fungi or psilocybin products for authorized transfer within the medical psilocybin program. Didn't we determine these were separate permits? And should they have separate?
No, it was going to be one permit with the different abilities within it.
So all of them will have
right
those. Okay, good to go. Produce or production means to engage in any activity related to the cultivation, harvesting, drying, storage, or preparation of psilocybin producing fungi or psilocybin products. Psilocybin product means psilocybin producing fungi, mycelium, or preparations derived therefrom that are intended for patient use and contain a detectable amount of psilocybin or psilocin. Recall means an action taken to remove a psilocybin product from distribution or use after the discovery of contamination, mislabeling, or other condition that may pose a risk to patient safety. Release of transfer means the point at which a psilocybin product has satisfied applicable testing and quality assurance requirements and may be transferred to another permitted entity. Segregate means to separate and withhold from transfer or use a batch or lot of psilocybin producing fungi or psilocybin products pending testing, investigation, or corrective action. And testing means laboratory analysis of psilocybin producing fungi or psilocybin products for potency, identity. We're not checking identity, right? And the presence of contaminants conducted by a laboratory approved or permitted by the department. I'm going to take identity out of there. Or maybe I won't.
I got
maybe
it.
You will. Maybe you will. And then there was a recommended strike mycelium from psilocybin products because we determined that we're not using mycelial biomass. Yep. Excellent. Looks like we already done that. Awesome. All right. So we have a little bit of time left. I would like to, at this time, open it up for discussion or questions about, things that we've already talked about, and also perhaps other proposals that we've missed in this document.
James has a really good point just in the chat, just as far as the size of the capsules and the purchasing of them, as far as the cost of that and the equipment. And I think, James, that's going to be determined over the next few months. I think before we get to the point where, you know, cultivators and producers are going to have to decide and make a decision on those, we'll have at least the guidance with regard to that pretty well in hand. They're moving forward with that as well, because I think that's a really great question and it's a really great thing to consider. And it does actually affect and impact some of the cost. So I think that's a good idea for it.
Yeah, and I understand your concern, James. I'm not trying to blow you off. I just don't have an answer for you yet. Something we have to decide at a couple levels first. So, are there any other questions about the document in its entirety? Dominic, can you remove the note, the highlighted note, since we've gone through and approved this entire document at this point? All right, so what I foresee happening next is I'll take this to the advisory board and we will present it to them on the 27th. Hopefully some of you will be watching in. I'm not sure how Ian's going to run it, but I don't know that there's going to be opportunity for public comment like there is in committee. We'll go through it kind of like we did in here and hopefully get this approved so the Department of Health can start making the rules or legalese out of all of this. And then following that process, Dominic, correct me if I'm wrong, there'll be time for public comment on the actual written rules, right?
Mm-hmm. So just so everybody has an idea of how the process works, is once the board has actually said yes to the recommendations or changed them, edited them, all of that, we will actually take them, and we're already starting to work on the drafts of them on some of the other sections that have already been, already had approval through this. And so what we will be doing is after that point, and we're hoping fairly quickly, because it is our primary task right now from the department standpoint, is that we will get those draft rules all set. We have to submit them to the registrar, or sorry, not the registrar, the New Mexico registry. Can you tell I've been dealing with some school items lately as I'm thinking about registrars? But anyway, we work with the New Mexico registry and we publish with them. And when we publish with them, that includes a link to those rules. And so then from the date of publication until the rule hearing, there is a minimum of 30 days. And so once that gets scheduled, then the 30 days, people can make public comment during that time period. At the rule hearing itself, what will then occur is there's a hearing officer. We essentially present the rules, and then the hearing officer opens it up to the public for any additional public comment. And then the hearing officer will set a deadline for any additional written comment. Usually it's a couple of days after the hearing itself. Sometimes if there's not been very much public comment, they may do it the end of that business day or the end of the next business day. But that is up to the hearing officer. And then once that occurs, the hearing officer then creates a report, brings that back to the department. If there are no major changes to be made, except for example, if there's a few typos or something else that just needed minor clarification, then the rules can be promulgated. Promulgated means they're published and then they go into effect on publication. If there are major changes that need to occur that were not addressed during the rule hearing, then at that point in time, we have to potentially go through a secondary rule hearing, and it follows that same process. But so all of the rules, like I said, the draft will be published. There will be 30 days from the date of announcement of the publication until the actual rule hearing at a minimum. Sometimes it's longer time. That quite frankly depends on the calendar and the availability of the hearing officer. But that way people are able to provide additional comment if they have other concerns or issues or questions at that time. I hope that helps.
Yeah, yes, that helps.
Okay.
Let me find my screen again. And then, so that's the large scale. For what I'm foreseeing for us is that, I'll take this to the board. They'll say, yes, this looks good. Here's the next set of questions we have for you all, or, rework these sections because we don't think they're safe enough, or whatever other questions they come up with. So we have a little break here, but this is a first draft document, and I imagine quite a bit of it will get passed through. I know some of the board members have already taken a look at it. But in likelihood, there's going to be more work to be done. So I've got 2 more meetings set up, hybrid meetings, one in Albuquerque on the 11th at West Mesa Community Center. Is that right, Johnny?
Yep, that's right.
Okay. And then one on the 18th, hybrid, so in person, online in Santa Fe, at a location to be determined. And I will upload any documents, or I'll have Johnny upload any documents that kind of go with those meetings or attach them to the invitation. Is that right? Or how are you doing that now,
Sort
Johnny?
of. Yeah, we're trying to figure out a good way to do that, and are still not super satisfied because, yeah, like today, I had to just, most of you saw, like, as of, a certain time this afternoon, / this morning, just emailed whoever happened to be signed up already, but I'm trying to figure out a better way that Teams will let me automatically do things, but currently not satisfied with finding something that works.
But we'll do our best to get the word out about topics and discussions prior to.
If nothing else, we are emailing it out to people so that they do have the documents. And yeah, because it's just, we keep running into this issue where every time we think we come up with a solution, our IT says, nope, that's a security risk. We can't do that. So it sort of limits us a little bit, but we want to make sure that things are done correctly. James does have in the chat ballpark month for permits to be available if there's no pushback. So that's a great question, James. If everything sort of falls into place as we just discussed, there's no major changes that need to happen. Once we do the draft, if that looks really great, we do the hearing, and we're able to promulgate after the first round of hearings. When that occur, or if that were to occur, we would anticipate it being in June to July, depending exactly when the dates fall. And part of the reason for that is, just as you mentioned, so that there is time for the inoculation until harvest, so that everything can be prepared and ready for patients in December. There is, just as a note on that, is some people have also said that the potential for there to be product available and medication available for some of the training sessions and things like that, but that's an issue for another committee at another time. And I really would encourage everybody. I know, Chris has said that, we get a little bit of a break, and we do at this point, or at least from the committee standpoint, there is. But those in-person meetings are going to be important, because part of our hope is that we'll have some more information by those meetings. And they're also, even though this first portion, this big heavy lift, is now entering into this next phase, and we're going to get a little bit of a break, once the rules are promulgated and we start doing this, that's quite frankly when we start finding out what things did we miss, what ideas that nobody has thought of as some of the initial permittees start actually going into production, and what kinds of things do we need to turn around and look at and potentially adjust within the rules, because we will be adjusting rules down the road. This is not a one and done for all of that, because we want to be responsive to the program, make sure that we're able to do things in a way that are going to be supportive for the producers, for the patients, for the facilitators. And so there'll be some things that we miss. I'd like to say we're perfect. We are not. And as we've seen with Oregon and Colorado and with other programs, you know, it's always a period of time of adjustments. And so we're going to have that period of time. And so we just ask that everybody also bear with us, because in the end of the day, what our primary goal is how do we help patients? How do we help people? And how do we do that as a community? And so, you know, that's going to be the goal. We're not always going to please everybody. We're not always going to have everything in the way everybody wants, but that truly is the goal. And that is a part of what we're trying to do. So please forgive us for mistakes in advance, but also don't hesitate to tell us that we've made a mistake. You know, we need to know that as well. So don't worry about it. You're not going to hurt my feelings. Unless you start calling me names, then that's a whole nother story. But, you know, you're not going to hurt my feelings. You're not going to hurt the team's feelings. If you say, look, you missed the boat on this, we need to figure out a way to do this differently. That tells us, you know what, we need to look at things and how do we change it? How do we make this better for people? So anyway, I'm going to shut up now and turn it back to you, Chris. But I just want to thank everybody for all of this. This is a lot of work. Thank you, everybody. And thank Chris, especially. You've been phenomenal in this entire process. And so back to you, Chris.
No, I also want to thank all of you for all of your work. And there's so many that aren't here today that I would like to thank as well if you come back and watch this video. And yeah, the process isn't over yet, but hopefully you'll be at the meeting on the 27th, and then I'll get to see some of you in person here on the 11th. So thank you all very much.
Thank you, everyone.